Hi everyone, a very good evening. Thank you so much for joining us on this Saturday evening for a session on diet, nutrition, exercise and labor pain relief during pregnancy. Right, so I will start with a very quick introduction. My name is Sonali Shivlani. I'm from Mumbai. I'm a pregnancy and postnatal consultant, certified with CAPA. I have been working in this field for more than 16 years now, and I have worked with almost 35,000 plus families. So that's my background. I love telling stories. I love explaining or talking about things with a lot of examples. So I'm hoping that we will have a nice and interactive session. But as you know, it's a nice and long session. It's at least 60 to 75 minutes of talk and then followed by Q&A. So what I would suggest is that all of you make yourself super comfortable, get all your pillows and whatever you require to make yourself relaxed and comfortable. Visit the bathroom. It's very important that during pregnancy you stay well hydrated. So grab your bottle of water. Even I have mine ready with me. So get yourself a nice bottle of water. If you want, you can also get a quick healthy snack, right? So we will be giving you 2-3 minutes to do all this. Make yourself comfortable, visit the bathroom, get water and get something snacky to eat so that you can be comfortable for the next 1.5 hours and then we will get started. Okay, so 2 minutes and get everything ready so that I can just dive straight into talking to you about all the things that I have planned for you for this evening. Just a few little things as to how the session will be working. First and foremost, if you realize all of you have been kept on mute, so you cannot use your microphone, you cannot speak during the session. What we would, and of course, but we do want you to ask questions because that's how we know that you are enjoying and you're learning. So what we would request is that you can put your questions, if you see your little dashboard, little panel that you have next to you, there is a box called questions. So you can put all your questions there and I will make sure that I answer all of them once I'm done with my section of the presentation. Okay, so that's the first thing that I would like to say. If you want to make any notes for yourself, you're most welcome to, because that's something that can help you to remember what we have discussed. But there is some good news. As you know, this session has been brought to you by Cordlife. Cordlife is one of India's leading stem cell banks. And after this session is over, in about 48 hours or so, the Cordlife team will be getting in touch with you and they will be sharing the recording of this session. So that is going to help you to have a chance to review and recap whatever content has been covered, right? So that's happening. Also, what is going to be done is that the team will be providing you with a special voucher. So all the participants of this session will be given a special gift voucher, which you can use for a little bit of shopping. Snack fun, that's exciting, right? So make sure you stay till the end of the session because I'm going to tell you all about this only in the end. Okay? And last but not the least, and actually I should say this first, I would like to give a very big thank you to Dr. Manu for giving us the opportunity to speak with all of you this evening. All right. So let's get started. And the focus of today is nutrition, exercise, and labor preparation. So we are going to start with the topic of nutrition for a healthy pregnancy. So the first thing that we have to make a note of is healthy eating habits. I think today mothers are so much more conscious. They are so much more aware and alert that many times when I'm counseling mothers or I'm talking to mothers about eating habits, about dietary habits, most mothers are eating healthy. Of course, balancing meals is another question, but eating healthy is more or less taken care of. You have to understand that eating healthy benefits not only the baby, but also the mother and the entire family. So many times when mothers kind of, when we ask them, why do you think you should eat healthy during pregnancy? And their answer is, it's good for my baby. That's not the only reason. It's for the mother as well as for the entire family. Now, what are the benefits for the baby? Let's start with that because obviously baby is the star of the show. And that is something that we are absolutely focused on. So the first thing that we are noting over here is optimal physical and mental development. Let me explain this with a simple example, right? Now think about it this way. If I have constructed a building and I've made it really strong and something which is absolutely with a very strong foundation, with good materials, everything perfect, if there is any kind of natural disaster, any problem, like an earthquake or a tsunami, my building will not fall down. My building will sustain itself. However, if it is not made well, if the foundation is not strong, it's a very good possibility that my building will fall down. And that's exactly what I mean by physical development. What are the earthquakes and tsunamis of human beings? Heart attack, hypertension, diabetes, all of these are earthquakes and tsunamis which come up. However, if we are healthy, if we make sure that, our foundation is strong, the organs that are made right from the time that you are pregnant are healthy and optimal, the baby will be able to grow in a healthy manner also. So it is not just a gift of health during pregnancy and for that baby when the baby is born. It is the gift of health for your child for the rest of his or her life. Now comes the mental development. I'm a mother myself. I have 2 children. And I would be a liar if I say that I don't get excited or happy or feel privileged when my child comes home with an A+ report card. It is definitely something which is very important to us as parents. We want our child to be the smartest. Okay. So I'm not saying that I'm trying to make Einsteins out of your babies, but there is a lot of brain development and brain growth that happens in the womb. Creating the gray matter is very important. And eating the right foods, which will help to enhance brain growth, is very important as well. So I'm going to share a few of those magic brain growth foods today as well with you. Then comes the ideal birth weight. Now, when we visit someone in the hospital, one of the first questions we want to know is if it's a boy or a girl. The next question that we ask is, was it a normal delivery or a cesarean? But the third question is, what is the weight of the baby? And the general fundamental, or why do we ask this, is because somewhere in our heads, we equate the weight of the baby with the health of the baby. Ideally, Indian babies are born at 2.5 to 3.5 kilos, and this is considered to be a good birth weight. Anything less than that, and there is a possibility that the baby will have early childhood issues and also difficulty during labor and delivery. Anything more than that, and there is obesity, and again there is difficulty in labor and delivery. So we definitely want a good birth weight, but we want it to be in the ideal range, which is between 2.5 to 3.5 kilos. And then there's the mother. My list is longer, right? Because I always tell my moms this, you are not Mother India. You are not doing this only for the baby. You have to do it for yourself also. Now, if I'm eating healthy, chances of my pregnancy being healthy and safe, which means away from various pregnancy complications, is going to be very high. Mothers who eat healthy generally don't get thyroid, gestational diabetes, hypertension, fluid retention, edema, all of those things, right? So we definitely want a healthy and safe pregnancy. As far as labor and delivery is concerned, 37 weeks is considered to be full term. But ideally, pregnancy is 40 weeks, which means the baby should come between weeks 37 to week 40. If the baby comes before that, then that means the baby might need the NICU. And that's not a good idea, isn't it? So keeping the baby in the womb, maintaining the ideal safe environment so that the baby finishes the term in the womb is very important. And this can happen only if the environment is correct. Imagine if I go to a hotel and I'm trying to kind of, I've booked myself there for a stay and the hotel is dirty, there are cockroaches in the room, the mirrors are broken, the bathroom's dirty, the bed is stinking. I won't want to stay, right? It's not the optimal environment. So the same thing, if the mother is eating healthy, the mother's body is the optimal hotel for the baby and the baby will stay the required duration. Then comes the birth experience. Think about pregnancy as the preparatory period for the actual delivery. If you have to run a marathon, you are not going to get up tomorrow morning and say, I am going to run the marathon today. It doesn't work that way. You will prepare. You will eat right, you will exercise, you will mentally prepare yourself, and then eventually after 6 to 8 months, you'll be ready to run the marathon. And that's what the 9 months pregnancy is. Ensure that you eat healthy, you exercise, and that will prepare your body to bear the labor pains in a more positive way. Your hormones are kept in check. I think if there are any dads in this room, you will agree with me that mothers are a little moody during pregnancy, a little irritable, a little cranky. Somehow they don't make any sense. They can be very illogical, which is very normal. It's all due to the pregnancy hormones. But there are some mothers who seem like angels and they seem to manage it all really well. And this is because their hormones are well balanced. Last but not the least is optimal weight gain. That was one thing which was very important for me also when I was pregnant. I wanted to make sure that my weight gain was optimal because I did not want to have to work very hard to lose my weight after I deliver. So making sure of all of these things are the benefits for the mother. Now during pregnancy, you need about 300 extra calories per day. Now we expect that a normal person eats a diet which is about 1800 to 2000 calories in an entire day. But during pregnancy, you need a little bit extra. Now it doesn't mean that you have to eat double because that's what generally happens, right? So normally if you would eat maybe 4 regular idlis for breakfast, suddenly you're not supposed to start eating 8 idlis for breakfast because you're pregnant and you should eat double. That doesn't work that way, right? So if you're having appams, you're having dosas for your main course, that doesn't mean that you double whatever you were eating. 300 extra calories is only going to account for maybe 2 extra idlis, 1 extra bowl of sambar, and maybe a small cup of milk. And that's your 300 extra calories, which you're supposed to have in the entire 24-hour period extra. Okay, so keep that in mind. After you deliver, the baby is going to be breastfeeding. And you still need those extra calories because your body is going to be supporting the baby while breastfeeding. So don't reduce your dietary intake. Continue the extra food the way you are eating during pregnancy. I think I mentioned balanced meals. I know everybody knows how to eat healthy, but here is how you're going to balance your meals. Yes, we look at the food pyramid, which is a very common picture. We've been seeing it since childhood, even in our textbooks. But today we're going to look at it from a pregnancy perspective, and I'm going to teach you from my end what I call my 5-finger rule. Now, the first finger of your pregnancy diet is called your carbohydrates. Now, simple examples of carbohydrates are your idli, your dosa, your appams, your upmas, your pohas. If you're having a busy belly bath, these are all examples of your carbohydrates. So anything which is made out of a cereal, you need to consume a minimum of 6 but an upper limit of 11 servings per day. So keep yourself focused. If you're having small idlis, then of course 1 idli is not 1 serving. You will need 2 to 3 idlis as 1 serving. But if you're eating idlis which are big in size, then 1 idli can be 1 serving. And if you have 2 idlis for breakfast, that means you are done with 2 servings and you have just 4 more at the minimum to complete during the day. Carbohydrates are required for overall fetal development, and it is very important that we choose unrefined grains. So when you're making your dosas, when you're making your idlis, I know, in South India, you use the best type of rice, the parboiled rice, the unpolished rice, red rice also in a lot of cases, which is perfect. Here in Mumbai, we all use a lot of white rice, and that is not the healthiest form. So Mumbaikars are considered to be, the fast forward generation, which seems to want shortcuts for everything. The next finger out of these five is going to be your fruits and vegetables. So when we're looking at fruits and vegetables, the main focus is that you have to choose a wide variety, right? Now when we're saying a wide variety, I understand there will be some favorites. I love these. I like to eat this. This is my favorite fruit. This is my favorite vegetable. A lot of people have that, right? But that doesn't mean you ignore the others. You should choose as many different colors as possible. This is one of the best ways to choose your fruits and vegetables. So if you're seeing the pictures also that I have on the screen, there are so many different colors that are there. And it looks so vibrant. It looks so beautiful, right? The other thing that you should remember about fruits and vegetables is always pick seasonal. Right? So right now, mangoes are not in season. So makes a lot of sense that you don't eat mangoes right now. Strawberries are still going to take a while to come in season. So make sure you don't eat strawberries right now. So choose your fruits and vegetables which are fresh, which are in wide range of colors, and which are seasonal. We recommend taking about 2 minimum servings of fruits and 3 minimum servings of vegetables in a 24-hour period. And to make it super simple, each serving equals to about 100 grams of the fruit or the vegetable. So these are vitamins and minerals. And you know what vitamins and minerals can do? Vitamins and minerals can help to ensure that your pregnancy is well supported. It keeps the pregnancy healthy. It allows you to carry to full term. So remember when we spoke about creating the right womb environment for your pregnancy? That's exactly what fruits and vegetables will do. And then I promised you something about brain development, right? And that's your third finger. So that's your proteins, right? Proteins are called the building block of cells. Now this is what happens. When the baby is conceived, the baby is like a little tiny dot. It's a single cell. Then the baby comes floating into the uterine environment and splits, becomes 2 cells. One cell becomes the placenta, the other cell remains the baby. The baby cell still further splits, and one part is going to become the brain and the other part is going to be the rest of the body. Now within the brain and the body, the cells will again keep multiplying and start growing. So eventually there will be blood cells, heart cells, lung cells, skin cells, all of that. And in the brain, there will be neurons which are created, which are called brain cells. So the more the protein intake, I mean, of course, it has to be in the adequate portion size, adequate requirements. That is going to ensure that your baby's brain development is on the optimal track. Now, what happens as far as brain development is concerned? We expect that the maximum brain development in the womb is in the 3rd trimester. So if there are some of you who are already almost ready to deliver and you are wondering if you are on the right track, oh my God, what did I do? I haven't eaten right so far. Don't worry, you still have a lot of time to go. There is still a lot of brain growth and development which will happen after the baby is born. So we can surely continue the protein intake even while you are breastfeeding, right? Now the goal is to have about 75 grams per day. And it's very difficult for you to count this, but I'm going to give you a few examples. If you have an egg, that's about 6 grams. If you have chicken or fish and the portion is about that size, the size of your palm, that can be about 15 grams of protein. If you are having a bowl of sambar and you have made it with some pulse or some dal, then that is also going to be equivalent to about 4 to 5 grams of protein. So these are a couple of things that you have to keep in mind, right? So suppose, for example, you're a vegetarian and you have sambar for your lunch and your dinner, but you don't have anything else from the protein group, which could be any other dal, any other legumes. So it could be your cholas, your rajmas, your green peas, the dried green peas, dried white peas, all of these, your nuts, your eggs, your soy. So your protein intake will be really low. So it's a good idea to try and increase this. And the best way to do this is that every single time you eat, literally, and we eat a lot, right? I mean, I would say we should eat at least 5 to 6 times during pregnancy. Every single time you eat, you should eat something from the protein groups. So sometimes nuts, sometimes seeds, maybe an egg, maybe some non-vegetarian food if you can. So those kind of things you should keep including in your diet on a regular basis. Then comes finger number 4, which is calcium. Now, calcium is very important for bone and teeth development. Everybody knows that. When the baby is born, the baby has bones, isn't it? And interestingly, the baby's teeth are also ready. It's just that they're not visible. So that's completely normal. Okay? But what we don't know is, or what is little known, is that there is optimal muscle and nervous system development also because of calcium, especially the heart muscle. So if you want to make that really strong heart, then you need to make sure that you have adequate calcium. Don't cheat on it. Right? The requirement is about 600 ml of milk or milk products. The general doubt that people have is that during pregnancy, they completely switch to full cream milk, which is not necessary. Full cream milk additionally has only extra fat. And that's not something which is necessary. So what you need is toned milk or skimmed milk, and you need about 600 ml of either milk, curd, lassi, or you could also have any other form that you like, but as long as it is about 600 ml in a 24-hour period. Now, there are some plant sources also like green leafy vegetables, nachni or ragi, which is a red grain, very popular in Maharashtra, but it is available now in all parts of India. Sesame seeds, jaggery, these are also considered to be great sources of calcium, but not as great as dairy, right? So think about it. To give you an example, 6 cups of spinach is going to be equivalent to 1 cup of milk. And that's a lot of disparity, right? Imagine if I have to eat 6 cups of spinach every day. But that doesn't mean that I get disheartened. So when you're making a dosa, you can put some spinach paste in the batter so that you get a little added load of spinach. Maybe add some other green leafy vegetables like bottle gourd, etc. when you're making your sambars. So those are things that you kind of, add into your diet so that you get all your calcium requirements. And the last finger is the most fun, which is fats, oils, and sweets. We need to have very little of this. We can't have a lot, right? Because fats kind of sneak in a lot of things. So they come in, of course, in your cooking, and then during pregnancy, you're asked to put a lot of ghee in everything. So that's also not something which is recommended. So have everything, but have little bit of everything. Try and choose some unsaturated fats such as olive oil, flax seeds, walnuts, other seeds also, almonds, all of these will give you some good fats which are great also for your overall energy and for the baby's brain development. These are some other nutrients and they are called nutrients even though they are really, really tiny. There's water, which I started with saying is very, very important. You need to consume about 8 to 10 glasses, which is about 2 to 2.5 liters in a 24-hour period. This is excellent in terms of your, maintaining your amniotic fluid levels, helping you to digest your food, keeping you well hydrated. So don't cheat on this. You do need a little bit of salt, so about 5 mg in your overall food so that you get adequate sodium in your diet. But avoid anything which is packaged, so don't have chips, don't have anything which has got an expiry date because that's going to have a lot of sodium in it. So sauces, pickles, all of these things you should be staying away from. Doctor would have prescribed you some supplements, which would be iron, calcium. In early pregnancy is folic acid and a multivitamin. And also later the doctor might ask you to take some omega-3. Please don't cheat on your supplements. There are times when some supplements don't suit you, and it's perfectly okay to ask the doctor for a substitute. Don't just cancel it off on your own, right? So take the supplements exactly as prescribed. Here are some foods that you should avoid during pregnancy. Things like raw meat and soft cheeses and unpasteurized milk, raw eggs. So be careful of desserts which have raw eggs, like a chocolate mousse, which is definitely interesting but not to be had during pregnancy. Fish in excess can give you high levels of mercury, which we would like to avoid. So eating fish 2 or 3 times a week is considered okay. More than that would become in excess. Caffeine, which is tea and coffee, is something that you should limit. At least don't have like a lot. You know, so many times I have working moms who end up having 6, 7, 8 cups of tea or coffee a day. Of course, their cups are small, but they still have quite a bit. So have in limited quantity because it will help to ensure that you don't get frequent urination. And caffeine also interferes with iron absorption. Avoid alcohol and any other form of drugs completely. If you need to take any medications during pregnancy and while breastfeeding, you should always get in touch with your doctor, confirm that it's okay for you, and then go ahead and take it. This is a list of controversial foods. So there's papaya, pineapple, which people say would cause a miscarriage. Well, it's best to avoid them if you have a doubt in your mind. But having a small portion of a ripe papaya is not harmful, but it's a small portion, not like a whole lot, and it has to be a ripe papaya. Dates are supposed to be heaty. That's a myth again. They are not. And the other thing that people say is dates are black or they're dark in color, so it's going to make a dark baby. That's not true. There is no food which is going to influence the color of your baby's skin. Coconut water is a healthy option. But a lot of people think that having coconut water is either going to give the baby a lot of hair, so the mother will get acidity. Or another myth that I've heard is that coconut water is going to make the baby's head look like a coconut, and it's going to be very difficult to deliver the baby. Again, not true. Ghee is always recommended to mothers to be had in excess, which doesn't make sense. Because what happens with ghee is that it's only a fat. It's only going to make you gain too much of weight if you have a lot. It doesn't go and line your birth canal. It's not going to make it super slippery for the baby to come out. Okay. So now we're going to move on to our next segment, which is prenatal exercises. I'm sure you've made a lot of notes and you have a lot of information now about all the things that you should be eating during pregnancy. So let's talk about another important aspect, which is exercises. Now there are lots and lots of benefits as far as exercise is concerned. It can help to reduce your back pain and any other discomforts. I think pregnancy brings in a lot of these, right? Calf pain, shoulder pain, headaches, acidity, feeling of being bloated. All of these are part and parcel of pregnancy, and exercise can help reduce this. It helps to increase your energy. It helps to make your moods better. Exercise is known as a mood elevator. Interestingly, it can help you to sleep better. I've had a lot of times mothers who come for my workout classes will tell me that it is, why don't we have a workout class every day? Because when I have a workout class every day, on the days that I work out, I can actually sleep much better that night. So, of course, it's impossible for us to do a workout class 6 days of the week. So we do it 2 or 3 times of the week. But I ask the mothers that maybe the other days you can go for a walk. Right? It can help to prevent excessive weight gain. So it's not that it is going to make you lose weight during pregnancy, but it can help you to prevent excessive weight gain. Increases your stamina, improves your muscle strength. You're going to need all of that during the delivery, isn't it? And then, of course, to take care of the baby after. It can reduce the incidence of pregnancy complications. We spoke about some of these. So nutrition helps and so does exercise. It will help you in delivering the baby just a little bit more faster, and definitely also a faster post-delivery recovery. Because you don't want to be lying on the bed with, a cloth tied around your head and cotton stuffed in your ears for a long time, isn't it? What you want to do is be up and about and be natural and normal and start enjoying your baby and getting back to normal life as soon as possible. The first thing that we always discuss whenever we talk about exercise is the pregnancy posture. When you look at the way the woman on the left is sitting, she's slouching. She's not taking proper back support. This woman is going to definitely have a lot of back pain. When you look at the picture on the right, the woman is sitting erect. She's got an entire back supported by the back of the chair. This woman will generally have fewer back pain problems. So even before you think of, oh my God, I have back pain during pregnancy, I need to do some exercises for it. You first need to correct your posture, think about how you're sitting, whether you're slouching, because that can greatly reduce your back pain problems. Here's another posture as far as pregnancy is concerned. Now, what happens during pregnancy? Let me show you this with the example of my hand. Okay, during pregnancy, the weight increases in the abdomen. So the thing that happens with the mother is that because of the weight increasing, the lower back starts getting a little bit of a curve. And there's a lot of pressure over here. That's the first thing, right? So as you can see in the picture, the lower back has a nice curve, the picture on the right. The other thing that also happens is that the breast size changes. So the mother has excessive weight in her chest region, due to which she tends to slouch forward, right? So you can imagine this is what her posture looks like, whereas normally it's supposed to be nice and straight like this. So therefore, during pregnancy, even when you're standing, you try and stand erect and tall. Try and push your shoulders back, so kind of hold your shoulders back and have your chest pulled out a little bit. So that will ensure that your back always stays straight and it reduces the incidence of back pain. Before you start doing any exercises, always consult with your doctor. Ask your doctor if you are okay to start exercising, and then you can begin. I'm going to show you a few simple exercises. If you would like to try out a few of those postures sitting right there, you could, so that you can have some questions for me at the end of this as to how we've done these exercises, okay? So the first one is really simple. It's neck rotations. And all that you have to do is slowly drop your chin to your chest, left ear to left shoulder, back of the head to the back, right ear to right shoulder, and your chin to your chest. Let's reverse this. Right ear to right shoulder, keeping all your shoulders straight, okay? Back of the head to the back, left ear to left shoulder, and your chin to your chest. And then come back to your starting position, okay? So that is something that you have to keep in mind. It's you can do this a few times a day. You can do that whenever you are comfortable. The next exercise that you should do, especially for mothers who work a lot on the computer or who are sitting and, maybe just doing repetitive movements or just sitting in one place, or if you feel that you have, discomfort in your hands. So just rotate your wrists very, very slowly, first in one direction, and then reverse it in the other direction, right? So again, do this a few times a day. It can also be a part of your warm-up. The same thing can be done with your feet. So while you're sitting over there, you can try this one out. Circle your ankles, first in one direction, and then now slowly circle them in the other direction. So now if you note, I've been always using the word slowly, right? So during pregnancy, don't be in a rush. Do everything super slowly. This is one of my most favorite exercises because I can do it sitting anywhere, right? So I can make myself comfortable, sit down, preferably on a mat so that, I don't have, I'm stable. Get both my feet together and keep my knees as low as possible. And that's called your butterfly position. You could flap up and down slowly, or you could do it really fast as well. So you could flap your knees up and down really fast too. This is a great exercise or position to maintain when you are sitting and watching television, maybe talking on the phone. So this is something which is really important to keep in mind, that you should try and sit in this position as much as possible, because what it does is it helps to open out your pelvis. And your pelvis is where the baby is at the time of the delivery. The baby has to come out through the pelvis. So when the pelvis is nice and flexible, the baby will be able to move out much more faster. For all of you who after correction of posture still have back pain issues, or you want to just strengthen your back, doing the cat and camel pose is a great exercise. So you start with all fours and slowly round out your back, look down at your navel, and then arch your back and look up at the ceiling, right? So as you can see, the arms are below the shoulders and the knees are hip width apart. So this is a great exercise. It can be done a few times a day. Many mothers have jokingly told me that sometimes when they feel a little bit of back pain at night, etc., suddenly they've gotten up in the middle of the night and they've done a few camel stretches right then and there, and their husbands have been super surprised that what is she doing in the middle of the night? She's gone on all fours and she's doing this arch and round and all of that. So definitely, but practice this on a regular basis. It can be very helpful. The pelvic tilt is another great exercise for your lower back. It can help to strengthen the back, and it helps the back pain to be much lesser. So lie down flat on the back, place your feet on the floor with your knees pointing towards the ceiling. Keep your hands next to your buttocks and slowly, do this very slowly, raise your buttocks off the floor, hold it there for 3 counts, and then slowly bring your buttocks down, right? So do this a few times. It's going to help in helping you to reduce your back pain issues. The next thing you have is leg raises. Now, when we're talking about leg raises, what you need to do is make sure you're lying down on the side. On any one side you can start with, but you should always do both the sides. Make sure your body is nice and, in a straight line. It shouldn't be like, the upper body is tilting forward, the buttocks are behind. So make it a nice straight line. Fold your lower leg, as you can see in the picture. Fold the lower leg because that will help to keep your body stable. And then what I want you to do is raise the upper leg to a full 90 degrees, right? So many times we end up doing only this much, which is 3/4 of the way. That's not a good idea. We have to raise it all the way to 90 degrees and then bring it down. So that's a great exercise again for your pelvis to improve the elasticity. Then you have your squats, right? Everybody probably is telling you that you need to squat during pregnancy. You need to also clean and wipe the floor during pregnancy. Well, that's not really necessary, but this is how you do your pregnancy squats. Again, I'm reminding you, always please ask your doctor, get proper permission before you start any exercises, because your pregnancy health is very important. So we don't know if there is any condition that the doctor is aware of. So you should always check before you start. It's good to take some support. So it could be a wall, it could be a nice strong chair. So we've used a chair in this exercise picture, and squat down. Try and go as low as possible with your legs really wide apart, so that there's enough room in between the legs and you're not squashing the baby's head, especially if you're full term. So legs really wide apart and try to go down as low as possible. Hold for a couple of counts and then come up. Deep breathing is important. I cannot stress the importance of deep breathing exercises during pregnancy. So what you need to do, and you can try this with me, you don't need permission from your doctor to practice deep breathing. So sit comfortably wherever you are, close your eyes. Place one hand on your abdomen, place the other hand on your chest. Take a deep breath in all the way till your lower abdomen. Don't hold your breath, and then now slowly exhale. Once again, take a deep breath in and slowly exhale. Inhale, exhale. Let's try one more time. Inhale, exhale, right? So that's deep breathing. It helps to build your lung capacity. It helps to strengthen your abdominal muscles. Then comes Kegels, which is another very big star exercise. And you can try this with me again as well. What we're working on is your pelvic floor or your vaginal muscles. You have to imagine, only imagine, don't do this in the bathroom, but imagine that you're trying to stop the flow of urine. So what would you do? You would tighten up your vaginal muscles and hold, and then you're allowed to urinate, so you release. So you hold and you release. Hold, release. Keep your breathing normal. Don't tighten up your abdomen. I'm sure you were tightening up your abdomen, right? So let's try it again. Hold, release, hold, release. One last time. Hold, release, right? Now, I'm sure you're thinking about the counts of all these exercises. Typically, whenever you start doing any exercise, you always start with lesser counts. Do about 8 to 10 counts and then slowly increase the numbers as per your strength and capacity. Kegels, I would love for you to reach about 150 to 200 Kegels every day. Deep breaths can be about 40 to 50. So build your strength up slowly because it can take some time. Now we're almost ready to move on to our last segment. I'm hoping that, you are making notes and putting a lot of questions in the question box for me because I'm all set to answer questions on all of these topics for you. So I'm going to move on to talking to you about labor and delivery next. And I'm sure that this is something which is a big question in your mind. It used to be in mine as well when I was pregnant because it's the fear of the unknown, right? We don't know what is going to happen, so we are a little scared. We are a little worried. We've heard only horror stories. And then we, of course, have all of these movies which show us a woman screaming, sweating, one loud scream, and the baby comes out. So we have all of those images in our mind, and that's something which we need to dispel of. So what happens during labor? The first thing that will happen is that there will be regular contractions. Generally, women ask me, what is a contraction? What does it feel like? How will I know? Trust me, you will know. Labor contractions are different. They feel like nothing that you've ever experienced before. They make you uncomfortable. It is painful. It kind of feels like spasms in the lower abdomen, all over your abdomen, lower back, maybe discomfort in your legs, thighs, buttocks. So it's overall you feel as if, your body is just cramping and relaxing. So you start getting regular contractions and which feel like period cramps but with a much greater intensity. The frequency and the intensity is going to go on increasing. So when you start feeling the contractions, what I would recommend is grab a paper, grab a pen and start making notes. When you're making notes, what are you going to write down? You're going to write the start of the contraction, then you're going to write the end of the contraction, right? Then when the next contraction comes, you write the start of the contraction, you write the end of the contraction. That's what you're going to do, okay? So what do you get from this? From the beginning of one contraction to the end of the same contraction is the duration. In early labor, the contractions are really short. But when labor becomes more advanced and the baby is almost ready to come out, the contractions become very long and they can be as long as 60 to 90 seconds, right? The other thing that you've written is the start of the contraction, right? So start of the contraction to start of the next contraction is known as your frequency. That is how far apart are the contractions coming. In early labor, the contractions can come even 45 minutes apart, an hour apart, and that's fairly normal. But when the baby is ready to come out, the contractions will be coming a minute apart. So you can imagine that the contractions are coming every minute. They're lasting for about 90 seconds. So you are in a lot of discomfort at that point of time. One of the things that I can share as a personal tip as well is that activity always increases the intensity. So think about it. When you are in labor, what happens? I'm ready to kind of, I wake up in the night, maybe I'm feeling the contractions. What do? I should get up, I should walk around. If I feel that the pain has gone away, it is most probably false labor, because false labor will disappear with activity. Now, if I get up and I walk around and my pain increases, comes like, oh my God, I can't do this, I need to go and sit down, then I know that this is real labor, right? So it may be time to wake up my husband, call my doctor. And when you call your doctor will ask you all of these things. What is the frequency? What is the duration? And one more thing that they will ask you is, are you getting any kind of discharge? If you get any kind of discharge, that is like either bleeding or fluid leaking, then you should immediately go to the doctor. When your contractions are coming regularly and they are coming about 20 minutes apart is when you should be going to the hospital. Now, the other point to go to the hospital is when the water bag breaks. So if you feel a trickle of water or you feel a gush of liquid, so you're feeling damp, that means that your amniotic sac has opened up and it is a possibility that the baby is going to come soon or labor will start soon. So even if you don't have contractions, which is starting to get leaking, then you should go into the hospital. Also, if there is any kind of bleeding, so if there is bright red blood, which kind of looks like the start of a period, that is also a time to go to the hospital, even if you don't have contractions. If you are nervous or your husband is nervous, then it is better that you go to the hospital because you can at least feel a little calmer. You'll be surrounded by people whom you perceive can keep you safe. In case the hospital is very far away from your home, so if you know it's traffic time and it is going to be difficult for you to reach the hospital, therefore it is better that you go and don't sit to wait for your contractions to be 20 minutes apart. When you arrive at the hospital, the doctor, whoever is on duty, will check you. If they establish that you're in labor, that really your labor contractions have started, then only they will admit you. Otherwise, they can send you home, and that's okay. Why do you want to be in the hospital and unnecessarily probably get, medications, etc.? So then you might as well go home and come back when labor really starts. Your vital signs are going to be monitored, and even the baby's heart tones are going to keep getting checked. So whether it's your temperature, whether it's your blood pressure, whether it's the baby's heart rate, all of this is going to help in, making sure that everything is normal for you. Labor is going to be allowed to progress naturally. There is going to be nothing which says that, we need to do this, we need to do that. So everything is normal. Labor is allowed to progress naturally. Let's talk a little bit about the first stage of labor. So what happens in the first stage of labor? You're going to hear this word a lot, cervix, right? Cervix is the base of the uterus which opens into the vagina. So during pregnancy, your cervix is long, thick, and it's tightly closed, right? Now, when labor starts, the first thing that the cervix is going to do is it's going to become short. And when the cervix becomes short, this process is called effacement. So the cervix will become short, the cervix will become thin, and this process is called effacement, and it is part of the first stage of labor. After this, the cervix has to open. The cervix has to open to 10 centimeters. That is the size of your baby's head. And once the cervix is open to 10 centimeters, only then we say that the first stage of labor is over and now the baby is ready to be moving down and out. So the first stage of labor is the opening of the cervix, the effacement and the dilatation. Now this stage can last a long time. For many first-time mothers, it can be anywhere from 8 to 12 to even 24 hours, which is very normal. It's not necessary that you're going to feel pain for the entire period. It is quite natural that early labor will progress very, very smoothly, especially while you're sleeping. And then when you are almost 3 or 4 centimeters dilated is when you actually realize that, okay, I think something is happening. So that's very, very normal. The second stage of labor is actually considered the birth of the baby. The baby is going to move out of the uterus, through the birth canal and out of the vagina, right? So that's the second stage of labor. Now in this stage, the mother's efforts, the pushing is also very important. The uterus will have contractions, the uterus will help to push the baby out, but so will the mother. Now, if you are a first-time mother, I'm sure you're like, oh my God, what is pushing? How am I supposed to do this? How will I know? Don't worry. You will know. You get a very strong urge to push. And I know it doesn't sound like a good thing, but it feels as if, you know, you want to pass a hard bowel movement. And that's completely normal. Okay? So the cervix is open. The baby is starting to move down. And the baby moves out of the vagina. So once the entire baby is delivered, we say the second stage of labor is completed. Labor is not over yet because we still need to deliver the placenta. And yes, you will have contractions again. So the contractions will resume and you will start feeling the discomfort again, but they're not as severe. They're much more milder. The doctor will ask you to give a few pushes again and kind of, you know, put a little bit of bearing down pressure, and the placenta will detach itself from the wall of the uterus and will get delivered. Now, this is what happens physiologically. The doctor is going to help you with all of this. But there are some magic tricks which can actually help you to get through the entire process of labor. And that's my job, to teach you these magic tricks. All right. So the first thing, and this is screaming. Now we've seen this in so many movies that we're like, oh my God, it's my right to scream during labor. And she says, don't scream. Of course, don't scream. Because when you scream, you not only use up so much energy, you also tighten yourself up, right? Now let's practice this, okay? We're going to practice this together. Just sit back comfortably, sit back and relax. Keep your eyes closed. Breathe normally. Okay? Now, what are we going to do? The first thing you're going to do is keep your face completely neutral, no expressions, no smile, no frown, no anger, just neutral. Okay? And think about what your vagina feels like. All right? Hold that thought. The next thing you're going to do for me is smile. Nice big smile. You're feeling very happy. It's a very exciting day. Lots of nice things are happening. You're super excited. Okay? Now think about what your vagina feels like. Hold that thought. Okay? Now you're really angry. And you're really, really angry and you're frowning and you're really grumpy and make that kind of a face. And when you've done that, think about what your vagina feels like. Hold that thought. And let's do one more. Okay? I'm going to count to 3 and together we're going to scream loudly. Okay? Ready? Let's go. 1, 2, 3. Ah! Did you scream? I don't think so. Let's do it one more time. And this time when you scream, please think about what your vagina feels like and hold that thought. Okay? Ready? Let's try it. 1, 2, 3. Ah! Got it? Right. Okay. Now I ask you to have 4 thoughts. Neutral face, smiling face, frowning face, screaming face. What did your vagina feel like? Did you notice a difference? So whenever I'm smiling, my vagina is also smiling. It's kind of loose and relaxed. But when I scream, my vagina tightens up. If I had started by telling you that whatever happens on your face happens in your vagina, you would have thought I'm crazy. But now I've given you a clear demonstration of what it actually is. So this is really important. Keep it in mind. Avoid screaming as much as possible during labor. If I'm not going to scream, what am I going to do? I'm going to breathe. Because when I breathe, I not only distract myself, but I also provide oxygen to my baby. Now, I taught you a deep breathing exercise earlier in this session, but during labor, deep breathing is not going to help you. What is going to help you is short breaths. And when I say short breaths, what I want you to do is breathe in through your nose and blow out through your mouth. And keep your air only to your chest. Let's practice 2 such really short contraction breaths with me. Keep your eyes closed. Just follow my instructions. Okay, don't worry, I'm not going to make you scream now. Okay, just follow my instructions. Relax your body. You can feel a contraction coming on. Take a deep breath in. Exhale. Breathe in through your nose. Blow out through your mouth. Short breaths only to your chest. Okay, just keep going. Breathe and blow. Nice and short breaths. And you can feel the contraction disappearing. So take a deep breath in and relax. Just relax. The contraction is gone. There's no pain. And when the next one will come, I'll let you know. But you need to conserve energy in between contractions. Just relax. You can feel another contraction coming. Prepare your body. Take a deep breath in. Exhale. Breathe in through your nose. Blow out through your mouth. Short breaths. And the contraction is disappearing. Take a deep breath in and relax. Okay? So, practice makes perfect, isn't it? So what you need to do is make sure that you do this on a regular basis every day once you reach week 28 and do it 5 times. I did really short ones. I did about 30-second contractions. You can start with 30 seconds, but then as you build your strength and practice, you can start doing about 60 to 90 seconds of the breathing and a minute of the break so that you're prepared for your most intense contractions. Okay? The third thing that you're going to do is visit the bathroom. Now, in the pelvis, there are 3 organs. There is the bladder, there is the uterus, and there is also your bowels. As you can see in the picture, they're all next to each other. Now, what happens? When the labor is about to start, most mothers will experience the need to go and empty their bowels. So maybe a day before, you'll start going to the bathroom very often. This is nature's way of making sure that there's more space in the pelvis, right? And then comes the bladder emptying. So when you go to the bathroom during labor, every 45 minutes to an hour, you will also empty your bladder, which will give more space for the birth canal, right? For the vaginal opening to be able to expand better. So always every 45 minutes to an hour, visit the bathroom so that you create more space for the baby to move down, and hence the baby can move down much faster. Try and be in an upright position. So if you can see, the baby, when the mother is lying down, doesn't have to come out straight like this. What the baby has to do is actually kind of, do a tilt and come out. So as you can see in the picture, the birth canal is then tilted upwards, especially for a mother who's lying down, which means that if you were to be upright, you would get the advantage of gravity. Plus, this is what the baby would have to do. The baby would have to come in a downward movement. So that is something which is really important. As far as possible, of course, I don't want you to exhaust yourself, but try and be in an upright position as much as possible. Then comes movement. And my best explanation for this is thinking about the pillows in your house, right? So imagine you have a pillow which is nice and big and fat, and you need to kind of, remove the pillow from the pillow cover, which is tight. What would you do? You would shake it, you would pull it, you would tug it, you would do all of those things, right? You wouldn't just hold it like this and expect the pillow to fall out. That's what happens. Your baby is the fat pillow and your uterus is the tight pillow cover. So you have to move and shake to ensure that the baby comes out much faster. So you can walk, you can squat, you can dance, you can sway, you can do some belly dancing as well, because all of these things will allow for movement and it will allow the baby to move down much faster. As far as eating and drinking during labor is concerned, always check with your doctor. So when you arrive at the hospital, ask the doctor if you're allowed to eat and drink. The next thing that you can do, remember to do, is keep sipping on water or suck on some ice chips, because this is going to help to keep you hydrated and also will help to keep you cool, right? In case ice chips are not available, you can also sip on cold water. You can also try some high sugar foods, such as glucose waters. You can carry some Glucon-D, mix it in that cold water. You can carry some soft sweets, the little candy that we tend to suck on when we want to have something yummy. Glucose biscuits or small pieces of chocolate. Sugar will always boost your energy levels, so you can use this during labor. If you eat really large meals, it can cause vomiting. And in case an emergency C-section is required, it can be risky as well, because you might end up choking on your own food. So that's something that the doctor may not be very comfortable with. So always check with your doctor before you kind of, look at eating and drinking during labor. The best statement that I can make is that birth is a new beginning, right? Welcome it with positivity. When you look at this beautiful little baby's picture, the only thing that comes to your face is a smile. But when we think about labor, then it kind of becomes a real challenge, right? That's the information from my end. Before I share the voucher details, before I talk to you about your questions and I open my question box, I would like to extend a very warm welcome to Dr. Manu, who was stuck in an emergency. Otherwise, she really wanted to join us, at the beginning of this session to welcome all of you. But since she was in an emergency, she was not able to do so. So welcome, Manu ma'am. Thank you so much for taking the time and joining us.
Thank you.
Yeah, we would love to hear from you. Just a few short words would be really helpful.
There's really not much for me to add, because I think you did a fantastic job about what the patients can expect in terms of how labor starts and how they have to cope with the labor pain. So that pretty much encompasses what you can expect during normal labor. So lot of patients get petrified about the labor pain, how they're going to manage, but it helps to have an open mind, because there are lots of options for pain relief in labor. There are injections, there's Entonox. So if a lady is not able to cope up with the labor pain, there are a lot of pain relief options apart from the breathing exercises, etc. So the best thing that helps women to cope with labor pain is to be completely prepared and knowledgeable, so they know what is going to come next, and use the options, the painkiller options, if they're not able to cope. So those options are always there. So if there are any questions about labor pain or the diet and exercise that Sonali spoke about?
Sure, ma'am, we'll open the floor to questions, but I'm just going to very also quickly share, the voucher details also. So if there are any questions, please do put them in the question box so we can answer them for you. I believe so far no questions have come, but as part of the session, thank you for all of you, attending the session. We also have a voucher for you. Cordlife brings you a voucher from Bumberry, which is an eco-friendly diaper. Today, all of us are very worried about, using diapers, using something which is unnatural, diaper rash, etc. So this is an opportunity. This is a reusable diaper. So it gives you the convenience of having a diaper, dryness, etc., but also completely friendly for the baby's skin and bottom. Okay. Um, and now just very quickly, these are my details. This is my website address. I can be reached on Instagram and Facebook with @baby360degrees. That's my handle. I would love for you to follow. And I have a YouTube channel, which is the Pregnancy Coach by Baby360degrees. So please make sure you subscribe because I post a lot of videos on all this space, right? So ma'am, I'm going to see if there are any questions, but if there aren't, then maybe you could, I could ask you a couple of questions which generally mothers have related to pregnancy and babies, if you don't mind.
Oh, totally. I don't mind.
Yeah, yeah, just a minute. I'm going to first see if there's any questions from the audience. All right. Yeah, there are a couple of questions. So there is somebody who's asking that, saying that the session was very informative, but she would like to know if episiotomy is required for every normal delivery.
See, most often episiotomies are required to prevent damage to the renal sphincter and the rectal mucosa. So, if a controlled cut is not given, the tear, if it's uncontrolled, can extend up to the motion passage and cause a complete perineal tear. So, to protect the anal passage, it becomes mandatory quite often to give a controlled small episiotomy. So we are not very often able to get away with it, especially in a first delivery. For a second or third delivery, yes, it may not be needed, but for a first, it's usually required.
Right. So actually, the thing is that many times, women ask this question, and the best example that I've been able to share with them is that maybe 100 years ago, life was very different for our grandmothers. They used to walk everywhere. They used to not have cars. They were doing a lot of housework, sitting a lot on the floor, even using Indian toilets. So our perineums are much more tighter than what it was for our forefathers. And that is probably the reason why episiotomies are required. Otherwise, I've also seen a couple of my mothers who've had third-degree tears, and that can be very painful. Okay, so I have a question from a mother who's asking, is folic acid good to take before planning a baby?
Folic acid is a pre-pregnancy vitamin and it's recommended that women take it 3 months prior to getting pregnant. So deficiency in folic acid can cause neural tube defects in the baby, and a problem that can be so easily prevented and fixed. You rather take that folic acid than have to deal with a folic acid deficiency and a baby with neural tube defects. So it makes sense to start folic acid 2-3 months prior to planning a pregnancy and continue the folic acid for the first 3 months. That would be an ideal scenario, but sometimes we have a surprise pregnancy and we haven't started our folic acid yet. It's not too late. You can still start it as soon as the pregnancy is confirmed. But in an ideal situation, it's better to start the folic acid 3 months earlier.
Perfect. Thank you so much. So there's an extension to the episiotomy question. How much time will an episiotomy take to heal?
It generally heals in about a week's time. So the stitches that we use, the sutures that we use are usually absorbable sutures, so they heal in about a week's time. So we recommend that women don't sit cross-legged on the floor to aid faster healing. And these days, a lot of tools are available. A lot of the patients are comfortable to use something called an episiotomy ring, which makes it easier to sit when you have the episiotomy, which is healing. Some other natural or non-medical treatments would be to use an ice pack or to use the ointments which help to heal the episiotomy faster.
Right. And I think it's also, I used to find it really comfortable to sit on a very big soft cushion because, it just allowed my perineum to not get a lot of pressure in the lower part, which I found personally very helpful. So maybe you can try that. And one of the things that I learned was that I need to make sure that my stitches stay clean. So always wash the stitches, when you urinate, etc., so that you don't breathe any kind of infections. That would be helpful in healing an episiotomy. I learned it the hard way. The second time round, I ended up with an infection, and I realized that I had been a little naughty with the cleaning part. All right. So I have a question from a mother. Does she need to monitor her thyroid levels during planning a baby?
We do get women in the pre-pregnancy stage who want to make sure that all their bloods are sorted before they plan a pregnancy, which would be the ideal scenario. So some of the things we check before pregnancy would be sugar levels, thyroid levels, vaccination, rubella, antibody levels, etc. And yes, if there is an abnormal thyroid level, it does make sense to make sure that the numbers are sorted before getting pregnant, because being hypothyroid in early pregnancy is not good for the baby. So if there's a chance to get all these things sorted before getting pregnant, that would be ideal.
Right. We would love to create an ideal scenario and a welcoming platform for the baby. So yes, if you have the opportunity, definitely do all of this before you conceive. All right. So the episiotomy question still continues, ma'am. Can I use the washroom efficiently after an episiotomy?
Sure, the stitch extends between the period passage and the motion passage. It is not anywhere on the motion passage. So there shouldn't be any problem in either passing urine or passing stools. So yes, when water falls on the episiotomy stitch, it's going to be uncomfortable, but there wouldn't be any connection between the episiotomy stitch or in emptying the bowels. So sometimes stool softeners are recommended when there's constipation, so that can be used. But the stitch itself will not interfere with using the washroom.
Perfect. Thank you. So there are a couple of exercise related questions. I'll answer those quickly. When should I walk, morning or evening? I would say walk whenever. But the main thing is make sure that you get your doctor's permission before you start doing any form of exercises. I have another mother who's saying that I'm in the 32nd week and I've not done any prenatal exercises till now. Is it okay to start the exercises explained? So yes, ma'am, please take permission from the doctor and start slowly. Don't start with like 100 squats on the first day. That's not recommended. You should start with about 8 to 10 and slowly build up your counts and intensity. There is a question on folic acid again. Should we continue taking folic acid for 9 months?
No, folic acid is given only up till the 3rd month of pregnancy. In certain situations, like if the mother had a previous baby with a problem, etc., it's continued. Otherwise, in most straightforward pregnancies, the folic acid is given only for the first 3 months of pregnancy.
All right. There's a question which says, if my water breaks and if the hospital is far, which is about 40 minutes driving distance, what should I do?
See, once water breaks, don't wait. Don't wait for the labor to start or don't wait for labor to progress. Get to the hospital as soon as possible. So long as you get there within 2-3 hours, that should be all right. But don't wait at home for things to move before you leave. As soon as you realize that your water is broken or bleeding has started or pain has started, make sure to get to the hospital in time so the doctors have a chance to monitor your baby, make sure baby's heartbeat is okay, etc.
Right. So even if the water breaks and there are no contractions, it doesn't mean that you have to stay at home. You must come to the hospital because now the baby's sterile environment is open. So we don't want to create any kind of risk or chance for the baby. So doesn't matter, 40 minutes is not too bad. So as soon as you feel dampness, just come. Okay. I am in my 31st week and have severe back and pubic pain. Is it normal?
Back pain is common in pregnancy because of the weight of the pregnancy, and some women have pre-existing back pain even before they're pregnant, and that gets worsened by the weight of the pregnancy. And what happens in pregnancy is that your center of gravity moves forward and the lumbar curvature increases, and that makes your back pain worse. When you come and tell me you have back pain in pregnancy, I would first want to make sure there's no labor, there's no medical complication. If all those things are ruled out, then I would send you to Sonali.
Okay, thank you. All right, perfect. So ma'am, there is a question with some myths, and I'm going to start by saying these are myths. right? So can a pregnant mother turn to the other side by rolling rather than sitting up? So I think, during pregnancy, I've heard this from a lot of mothers. They're told that if you want to turn from your left side to your right side, you should first sit up and then lie down on your right side. Otherwise, the cord will get wrapped around the neck. So that's a myth. I think ma'am will also account for that.
Definitely a myth. So
Yeah.
when you're sleeping, the best position is to lie on your sides because that improves the blood flow to the baby. Switching sides is absolutely fine to lie flat for a few minutes before you switch. So just make sure you don't lie flat for a long time because that would reduce the blood flow to the baby. It's all right to switch from side to side so long as you're sleeping on your back only for a short time. And your sleeping position has nothing to do with the cord going around the baby's neck. There's absolutely no connection at all. But the best advice here would be not to lie down flat on your back for long periods of time. That reduces the blood flow to the baby. So sleeping on the sides is the best option.
Okay, so I have a mother who's in the 7th week of her pregnancy and she wants to know if she takes double the dose of folic acid, is it harmful?
The prescribed dose is enough. It is not recommended that double the dose be taken because folic acid is a water-soluble vitamin and anything in excess is only going to get excreted out of the body. It doesn't make sense to take double the dose. So a person's body can absorb only so much and that's the prescribed medication that we give. So it doesn't make sense to take double the dose. The recommended dose is more than enough.
Right. So there is a mother who has a low-lying placenta and she wants to know whether it will be corrected on its own. And is it okay for her to do some kind of mild walking for half an hour or so?
Low-lying placenta is always a risk of bleeding. So we are worried that a bleed episode will happen. So these are some of the situations where we recommend that our mothers don't exercise and don't travel, etc. So how often the placenta moves up, it really depends on an individual scenario. So we do expect that the placenta will move up as the pregnancy progresses, as the uterus enlarges, the placenta moves upwards and that happens quite often, but not always. So these are the things that we monitor when we do the ultrasound. So as long as the placenta remains low down, there's always a risk of bleeding, which we don't want. So somebody with a low-lying placenta, we would recommend that she avoid exercise, avoid travel, avoid sexual intercourse. So these are precautions that we need to take to make sure the placenta doesn't bleed. We will monitor the placenta in subsequent scans to figure out if it's moved up. And only when we do an ultrasound, we will be able to see that. Quite often it moves up, rarely it doesn't. So as long as the placenta is down, I think it's important to follow the precautions.
Right. Okay. So there is somebody who's missed something because the sound dropped. So I'm so sorry, but I don't know what you have missed. So I don't know what to ask ma'am to repeat, but don't worry. This recording is going to be shared with you by the Cordlife team. So you'll be able to catch the answer at that point of time. And ma'am has already beautifully explained the sleeping position. So you can sleep on your left side or your right side. You can turn sides while lying down. It is advisable to sleep on the left side because that's the optimal blood flow. Avoid sleeping on the back, but if you sleep on the back for a few minutes, it's not a disaster. Also, digestion is better when you sleep on your left side. So I would suggest, use a lot of pillows, support your back, support your head, put a pillow between your legs. These can actually make you comfortable while sleeping on your sides as well. If after this, there's no place for the husband on the bed, then that's a different issue. Right? Okay, so I think, ma'am, that is all the questions that are there. We've answered all of them. Thank you so much for taking the time and answering all the questions. It was really, really helpful. Audience, we are going to close the session in about a minute or so. If there are any more questions, please do post them so that we can take care of it. And we've shared all the details. I've also given all my social media handles. So I do answer questions through that platform as well. So if there are any queries, you can post it on my YouTube videos or on my Instagram.
So thank you so much. This was very, very informative. These are questions that we get every day from our patients. What do we eat? When do we exercise? What do we do? So it's really, really useful, and I'm sure all the women who attended today would have really benefited by the information that you've given. Thank you so much.
Thank you so much, ma'am. Thank you, mamas and papas. If there are any daddies also who joined us, thank you so much for joining us. I'm sorry I forgot to switch on my lights, so the atmosphere became nice and dark outside, and my face looks as if it's in some kind of a twilight zone right now. All right, thank you everybody. Thank you so much for joining us, and have a great weekend ahead. Have a safe pregnancy and a safe birth.